How to treat and cure sacroiliac joint pain. The sacroiliac joint is located at the bottom and just to the side of the back. They can become inflamed and painful. We explain the condition including symptoms and treatment. Sacroiliac joint pain is usually located either to the left or right of the lower back, although patients sometimes described it as a band of pain across the lower back. Pain can range from an ache to a sharp pain which can restrict movement. Sacroiliac joint pain may radiate out into your buttocks and low back and will often radiate to the front into the groin and occasionally testicles. Stiffness in the lower back when getting up after sitting for long periods and when getting up from bed in the morning is also common. The sacroiliac joints are located at the very bottom of the back, one either side of the spine, and help make up the rear part of the pelvic girdle. SIG dysfunction is a term which is commonly used when talking about sacroiliac injuries. This dysfunction refers to either hypo or hypermobility, low or high respectively. In other words, the joint can become locked or be too mobile. This leads to problems with surrounding tissues such as ligaments and muscles, causing a wide range of symptoms throughout the lower back and buttocks. Sacroiliac joint pain can occur from 4 different causes: traumatic, biomechanical, hormonal and inflammatory joint disease. There are 2 of them in your lower back, and they sit on each side of your spine. Their main job is to carry the weight of your upper body when you stand or walk and shift that load to your legs. It could be a dull or sharp. It starts at your SI joint, but it can move to your buttocks, thighs, groin, or upper back. Sometimes standing up triggers the pain, and a lot of times you feel it only on one side of your lower back. You may notice that it bothers you more in the morning and gets better during the day. It's more common than you might think. About 15% to 30% of people who hurt like this have a problem with the SI joint. The pain starts when your SI joint gets inflamed. There are several reasons it could happen. You could hurt it when you play sports or if you fall down. You might also get this problem from an activity that gives the area a regular pounding, like jogging. Sometimes you start hurting when the ligaments that hold your SI joint together are damaged, which may make the joint move abnormally. Arthritis can lead to the problem. A type that affects your spine, called ankylosing spondylitis, can damage the SI joint. You'll also hurt when the cartilage over the SI joint slowly wears away as you age. SI joint pain may also start if you're pregnant. Your body releases hormones that cause your joints to loosen up and move more, which leads to changes in the way the joints move. Symptoms of SI joint pain. There are some common symptoms. Low back pain, usually a dull ache on one side of your lower back that may extend into the thigh. It is usually below the L5, or lowest lumbar vertebrae. Buttock pain. Pain can range from an ache to a sharp stabbing pain that extends down one or both legs. Low back pain while climbing stairs. Activities that require the pelvis to twist may produce SI joint pain. Difficulty sitting or lying on one side, often experienced as an ache on one side that causes you to shift weight to one side to relieve the pain in the other. Causes of SI joint dysfunction. There are a number of disorders that can affect the joints, including those that cause sacroiliac joint dysfunction and its resulting pain in the SI joint. Learn more about the most common causes of SI joint pain. Sacroiliitis. Osteoarthritis. SI joint injury. Altered walking pattern. Infection. Prior lumbar fusion. Pregnancy. Diagnosing SI joint pain. Though one of the first steps in getting to the bottom of SI joint pain is a thorough history and medical evaluation, there are other specific tests that physicians can conduct which can lead to a more definitive diagnosis of SI joint dysfunction. These include SI joint provocative tests, SI joint injections, treating SI joint pain, From non-invasive treatment options like SI joint belts and chiropractic care to surgical treatment in more serious SI joint dysfunction cases, there are now more options for treating SI joint pain than ever before. Find a physician with experience treating SI joint dysfunction to learn which of these options may be right for you. SI joint belts. Medication. Physical therapy. Chiropractic. SI joint injections. Radiofrequency ablation. SI joint fusion. Treatment of sacroiliac joint pain. Rest from any activities which cause pain, particularly running. Wearing a sacroiliac support belt which may help take the strain off the joint and provide relief from symptoms. It works by applying compression around the hip and across the joint, protecting it from further injury. If muscle spasm around the area is suspected, use a heat pack to help them relax. Don't heat if acute inflammation of the joint is suspected, though, as this will make the condition worse. In this case, cold therapy may be more effective. A doctor may prescribe anti-inflammatory medications such as ibuprofen, which can help reduce inflammation and relax muscles. A therapist who specializes in back conditions can do a full assessment and diagnostic tests to discover the cause of the problem, ruling out medical diseases such as ankylosing spondylitis. Electrotherapy such as ultrasound or interferential may be used to treat soft tissues, and if indicated and safe to do, level the pelvis via sacroiliac joint manipulation and mobilization. Sports massage may help relieve any soft tissue tension in the area. Exercises. A rehabilitation program to correct any muscle imbalances is important. This is likely to include Pilates exercises which may help strengthen the core muscles of the trunk. If the above treatment fails, a corticosteroid injection into the SIG may be used. Stretching exercises for the muscles of the hip, particularly the hip abductors, on the outside, and gluteal muscles can help if done gently. However, too much stretching with a hypermobile joint can inflame the joint and increase pain. Typical treatments for sacroiliac joint dysfunction include ice, heat, and rest. Initial treatment recommendations will typically include use of ice or cold packs, applied in 15 to 20-minute intervals as needed to reduce inflammation in the area, along with rest to reduce irritation. Depending on the duration of sharp, intense pain, ice can be continued anywhere between 2 days to 2 weeks. Once the inflammation is less, gradual return to normal activities may be advisable. Application of heat, such as a heat wrap or hot bath, may help the healing process, but not during the acute, high-intense pain time frame. Medications. First line of treatment often may include pain medications, as well as anti-inflammatory medications to reduce the swelling that is usually contributing to the patient's pain. Chiropractic manipulations. Manual manipulation provided by a chiropractor, osteopathic doctor, or other qualified health practitioner may help. This can be highly effective when the SI joint is fixated or stuck. It may be irritating if the SI joint is hypermobile. This is accomplished by a number of methods, including, but not limited to, side posture manipulation, drop technique, blocking techniques, and instrument-guided methods. Your healthcare provider will choose a method they feel is most appropriate for your specific case. Supports or braces. When the SI joint is hypermobile or too loose, an orthotic or brace about the size of a rather wide belt can be wrapped around the waist and pulled snugly to stabilize the area. This can sometimes be very helpful at times when the joint is inflamed or painful. When it calms down, the orthotic can be weaned away. Physical therapy and exercise. Controlled, gradual physical therapy may be helpful to strengthen the muscles around the sacroiliac joint and appropriately increase range of motion. In addition, any type of gentle, low-impact aerobic exercise will help increase the flow of blood to the area, which in turn stimulates a healing response. For severe pain, water therapy may be a reasonable option, as the water provides buoyancy for the body and reduces stress on the painful joint. Sacroiliac joint injections. While the primary reason for sacroiliac joint injections is to determine whether or not the sacroiliac joint is the cause of the patient's pain, it is also useful in providing immediate pain relief. As part of the injection, an anesthetic is typically injected along with an anti-inflammatory medication to help reduce inflammation around the joint, which in turn will help alleviate the pain. Sacroiliac joint fusion. For severe cases of pain that are not addressed by several weeks or months of one or a combination of the above treatments, surgery may be a possible option. In surgery, one or both of the sacroiliac joints may be fused with the goal of eliminating any abnormal motion. Some other ways to feel better. Physical therapy. Exercises can improve strength and make you more flexible. You'll learn to correct any habits you might have picked up when you were trying to avoid pain, like walking with a limp or leaning to one side. Your therapist may try ultrasound, heat and cold treatments, massage, and stretching. Injections. You may get a shot of cortisone to cut down the inflammation in your joint. If that doesn't help, your doctor may numb the nerves around your SI joint to give you relief. Your doctor might also inject a solution of natural ingredients, such as saline, and numbing drugs into your joint. You may hear him call this prolotherapy. It's thought to help tighten loose ligaments, if that's the cause of your SI joint problem. Chiropractic treatment. Adjustments by a chiropractor can help relieve pain. He'll use techniques that move your muscles and joints. Nerve treatment. Your doctor may use a needle to permanently damage the nerve that sends pain signals from your SI joint to your brain. He may also freeze it with an injection, though that technique isn't used much. Recovery and prevention. A positive attitude, regular activity, and a prompt return to work are all very important elements of recovery. If regular job duties cannot be performed initially, modified, light or restricted, duty may be prescribed for a limited time. Prevention is key to avoiding recurrence. Proper lifting techniques. Good posture during sitting, standing, moving, and sleeping. Regular exercise with stretching/strengthening. An ergonomic work area. Good nutrition, healthy weight, lean body mass. Stress management and relaxation techniques. No smoking. The immediate pain relief can help the patient start with a physical therapy program and return to normal activity levels.